Congenital corneal lesions. Megalocornea. Cornea with greatest diameter greater than 13 millimeters. This is an X-linked recessive inheritance disorder. Normal corneal structure with no Descemet's membrane rupture. Deep anterior chamber, cataract with lens subluxation and pigmentary glaucoma. It is rarely associated with renal cell carcinoma. Abnormalities of curvature. Posterior keratoconus. Posterior ambilication of central corneal stroma. Descemet's membrane is present but thin. Congenital corneal opacities. Sclerocornea. Congenital misalignment of corneal collagen. Cornea is diffusely scarred and vascularized resembling sclera. There is no hereditary pattern. Pathology. Thickened epithelium. Absent Bowman's membrane. Scarring and vascularization of anterior third of stroma. Thinning of Descemet's membrane. Electron microscopy shows random orientation of collagen fibers of various diameters. Association, nystagmus and strabismus, cornea plana, aniridia and glaucoma, and microphthalmus. Other congenital corneal opacities include solid epibulbar dermoids, complex choristomas, and golden heart syndrome. Congenital corneal staphyloma. Markedly atrophic iris adheres to back of markedly thickened, scarred, and vascularized cornea. Peripheral dysgenesis of cornea and iris. Axenfeld-Rieger syndrome or mesodermal dysgenesis. A clinical spectrum that includes posterior embryotoxin of Axenfeld. Termination of Descemet's membrane is more central and enlarged, resulting in a prominent anteriorly displaced Schwalb's ring. Posterior embryotoxin is present in 15 to 30% of normal eyes. Axenfeld's anomaly. Posterior embryotoxin in addition to the presence of iris processes attached to the ring. Glaucoma develops in 50% of cases. Rieger syndrome. Autosomal dominant condition representing neural crest abnormality. Axenfeld's anomaly in addition to presence of iris stromal bands extending to corneal periphery. Stromal defects such as stromal hypoplasia, slit pupils, polychoria, and pseudochoria. Glaucoma develops in 60% of cases. Systemic findings include skeletal, facial, and dental anomalies, umbilical hernia. Central corneal dysgenesis. Peters anomaly. Etiology. Sporadic, autosomal dominant or autosomal recessive disorder, bilateral in 80% of cases. There are central corneal opacities, iridocorneal and keratolenticular adhesions, absent endothelium, Descemet's and Bowman's membrane centrally, with anterior polar cataract. Association. Glaucoma 50%. Systemic associations. Fetal alcohol syndrome, accutaneous toxicity, intrauterine infection. Central corneal dysgenesis. Posterior ulcer of von Hippel. This is a congenital corneal opacity. It resembles Peters but with no lens involvement. The endothelium and Descemet's membrane are absent centrally. Central corneal dysgenesis. Post-embryotoxin. Axenfeld anomaly. Rieger syndrome associated with iris stromal defects. Peters anomaly. Posterior ulcer of von Hippel. Differences between common corneal dysgenesis. Cornea plana. Flat peripheral opacification. Inherited as autosomal dominant or autosomal recessive disorder. Associated ocular anomalies include posterior embryotoxin, uveal colobomas, and cataract. Sclerocornea. Opacified vascularized cornea. Inherited as autosomal dominant or autosomal recessive disorder. Angle dysgenesis, coloboma, and microphthalmus are associated ocular anomalies. Associated systemic findings include head bones and ear anomalies. Posterior embryotoxin and Axenfeld's anomaly. Prominent Schwalb's ring with abnormal iris processes attached to it. It occurs sporadically or as an autosomal dominant disorder. Glaucoma is associated in 50% of cases. Rare skeletal anomalies may be associated. Rieger's anomaly. Central differences between common corneal dysgenesis. Cornea plana, flat peripheral opacification, inherited as autosomal dominant or autosomal recessive disorder. Associated ocular anomalies include posterior embryotoxin, uveal colobomas, and cataract. Sclerocornea, opacified vascularized cornea, inherited as autosomal dominant or autosomal recessive disorder. Angle dysgenesis, coloboma, and microphthalmos are associated ocular anomalies. Associated systemic findings include head bones and ear anomalies. Posterior embryotoxin and Axenfeld's anomaly. Prominent Schwab's ring with abnormal iris processes attached to it. It occurs sporadically or as an autosomal dominant disorder. Glaucoma is associated in 50% of cases. Rare skeletal anomalies may be associated. Reiger's anomaly and syndrome. This means Axenfeld's anomaly with iris bands extending to corneal periphery and correctopia with polychoria. This is an autosomal dominant disorder. Associated ocular anomalies include glaucoma in 60% of cases, corneal endlines, opacities. Associated systemic findings include dental and skeletal anomalies, Reiger's syndrome. Peters anomaly and von Hippel's anomaly. Iris stromal bands adhere to back of cornea, absent endothelium Descemet's membrane centrally. This is an autosomal recessive disorder. Associated ocular anomalies include keratolenticular adhesions with cataract, microphthalmia, keratitis in von Hippel's anomaly. Skeletal, cardiovascular, and urogenital anomalies may also be associated.